JamiaTV, Beacon for the Nation. This program is suitable for general viewing.
Assalamu alaikum wa rahmatullahi wa barakatuh. Ahlan wa sahlan wa marhaban bikum. Good evening and welcome to live real talk show on JamiaTV. My name is Zamzam Ahmed, and tonight we are going to talk about hypertension, the silent killer. What is hypertension and why is it called the silent killer? And in studio tonight I am joined by Dr. Mutai Kipkoech, who is a general practitioner from Oma Medical Center. Daktari,
yes,
good evening.
Good evening to you. How are you?
I'm good, alhamdulillah. What about you?
I'm great, and thank you.
Karibu sana JamiaTV.
Asante.
It's good to have you here tonight.
Sure.
And because we're talking about hypertension and you are a general practitioner, perhaps you can get to know a bit about hypertension. What is hypertension?
Okay, thank you, Zamza. And it's a pleasure, at least, to talk to your viewers, at least to make them learn, at least to understand what hypertension is. So I know for our viewers, they need to understand what real hypertension is in a layman's language. So I'll say hypertension hypothetically means the increase in high blood pressure. Mm-hmm. So we have different ranges, but just it is a blood pressure of more than 140, that is what is called systolic, mm-hmm. over 90, that is what is called diastolic. Mm-hmm. And ideally, this is whereby the arteries ideally have consistently get resistance due to narrowing of blood pressure. That is essentially now means there is high blood pressure, mm-hmm. To the supply to the body. Mm-hmm. So essentially that is, in a nutshell, that is what high blood pressure is. Mm-hmm. Yeah. Okay.
So we normally hear about hypertension. We also have hypertension.
Yes.
What is hypertension?
So hypertension again is whereby the blood pressure is lower than mm-hmm. the normal range. Mm-hmm. So just to give you what ranges are, is a normal or a normal blood pressure is a blood pressure of diastolic or systolic, that is 90 on the lower side, mm-hmm. and 140 on the upper side, mm-hmm. and that is on systolic. On diastolic we have 60 on the lower side, mm-hmm. and 90 on the upper side. Okay. So when you talk about hypertension, is any blood pressure which is less than 90 or over 60. So that is hypertension, which is opposite of hypertension. Mm-hmm.
Okay. Yeah. Now, when we talk about the silent killer, yeah. why is hypertension referred to as the silent killer?
Okay. Thank you. So generally, hypertension has no symptoms. Mm-hmm. So ideally, you'll realize that for hypertension, you rarely have symptoms unless, let's say, there is already complications which are starting to develop. Mm-hmm. So it's called silent because it is eating you up slowly, mm-hmm. slowly, until now one day it shuts you down, majorly when now we have complications starting to check in. Nonetheless, even though we have a few people who start getting symptoms, so it is not something that you can quickly get to know that I have hypertension. It's something that eats you up slowly, and the reason why it's called silent. Mm-hmm. Yeah.
Okay. What about the factual or the facts about these two blood pressure, high blood pressure and low blood pressure?
Okay. So in factual, when we say high blood pressure, both are risky. Okay. That is because your body is functioning well to the organs, to the pumping of blood to the organs. Mm-hmm. Ideally, there is a range, and the reason why I mentioned there is the systolic and diastolic, not mm-hmm. more than 140 over 90, mm-hmm. and 90 over 60. Mm-hmm. So the body's function is within that blood pressure. Okay. So if you have hypertension, we have risks, okay. which ideally will come with hypertension. Mm-hmm. When we have hypertension, also we have risk that ideally also can lead to death. So both are risky, mm-hmm. but at least I'll say for today we'll majorly focus on hypertension because that is, I'll say, 90% are people who present with hypertension. Yeah.
And I believe most of the people, the 90% you talk about having hypertension, most of these people are unaware that they have it. And those people who have it also, I can say only minority are treated or have controlled blood pressure. Now let's look at the types of hypertension.
Yes.
Okay.
So thank you, Zamzam. So I'll say we have different types of high blood pressure. So one, we always have what is called primary hypertension and what is called secondary hypertension. So just to mention on the two types, we have the primary one, which ideally it comes as you age. That is one, and also majorly is contributed by things which are within you, the lifestyle of I'll say what you eat, what you do, the nature of the activities that you do. So this is what is primary. We also have secondary hypertension, and with secondary hypertension, I'll say this is something again which is secondary, means it's a trigger of something, and you'll find that most of the people that have this secondary hypertension, the main causes include someone who has an underlying condition like a kidney issue. So a kidney issue can easily make you get high blood pressure. I'll say also people who have hormonal problem. So people who have thyroid issues can easily also get high blood pressure. Also, I'll say people who use hormonal treatment. So we have hormonal treatment at times can also cause, for example, people who use family planning. There are people who use family planning and can easily cause that. We also have steroid-induced hypertension. So ideally, I'll say secondary hypertension is a result of something in your body that you can trigger it easily. And it can happen within any age, unlike the primary hypertension.
Okay.
Yeah.
When we talk about primary hypertension, because you've also talked about the different causes, perhaps you can expound a little bit more on the different causes of hypertension. Okay.
So I'll mention, as we mentioned initially, we have two types, and I'll say with the two causes, majorly they can easily lead to each other. So for example, age is a factor. As I mentioned, as primary hypertension, it is what is called a predisposing factor. It's something that can lead you, and you'll find that hypertension can affect any age, but the higher percentage are the elderly. As you age, you start getting hypertension. Number two also is people who have what is called sedentary lifestyle. So sedentary lifestyle, I'll just mention people who smoke, people who are inactive or do less of exercise. I'll also mention that people who eat junky food, those one also, they become obese or overweight. So that is also a contributing factor. I'll also mention that as we said, there are those people who have some conditions, underlying kidney. So those are among us the primary predisposing factors that can easily lead one into getting hypertension.
Okay, aging as a factor that can cause or causes hypertension that you have categorized in the primary hypertension. What about this person who is young? Can a young person be affected by hypertension?
Yes, sure. So yes, we have young people, even young children who can easily get hypertension. And again, as I mentioned, since they get majorly due to a secondary underlying condition. So maybe they have an hormonal issue, a thyroid problem can cause that. Also another thing, maybe they get a kidney injury, which can easily result into high blood pressure. There is also something that it is really important that I had forgotten to mention about we normally call it hereditary. That is, a history of high blood pressure can also contribute. So you can get at a young age, even as young as 12 years, people get what is called hypertension. Or there could be an underlying condition like a heart problem, which can lead into what is called hypertension. So yes, hypertension can easily affect also young children, but majorly it's due to an underlying condition.
And other than knowing these causes, perhaps for a person, because earlier on I mentioned that most people who have hypertension don't know that they have it, right? Now, how, as a person who's keen about my health, how would I know that I'm affected? So talk about the symptoms of hypertension.
Great. Thank you, Zamzam. So again, I'll mention the key thing here is hypertension is a silent killer. And rarely will you get symptoms, even though people do get symptoms. But again, these symptoms are generalized. You can have that symptom, but it doesn't necessarily mean that it is hypertension. So things like headache, a persistent headache, and we have different kinds of headaches. So we have what is called a frontal headache, a temporal headache, and a generalized or global headache. So with these headache, for ideally hypertension, you'll get it on the sides. So you get a persistent temporal headache. So that is one. Number two is dizziness. You get at times you feel dizzy. When you stand up, you get dizziness. Something else also that among the symptoms is blurry of vision. So with time, you start getting some complications seeing, or maybe you're not seeing far. So I'm not saying that people who also have defects with eyes have hypertension, but at least it is one of the signs. We also get people who swell, what we call pedal edema. So you get swelling when you wake up in the morning or you walk. You can also have that edema. Then also shortness of breath or persistent chest pain. So it is general, but I'll say those are the leading ones. Even though these symptoms are general, we also have other conditions which causes these symptoms. But when we have these, we immediately want to check your blood pressure. How is it as one of the causes of the symptoms that I've mentioned? Yeah.
Okay, when you talk about chest issues or maybe short of breath, how would you differentiate between hypertension and asthma? Okay,
thank you. So I'll just quickly mention that blood pressure is one of the vital signs. When always you walk into a facility, a doctor will always want to check on how are your vitals. So vitals, as just mentioned, includes temperature, check on how is your pulse rate, how is the heartbeat. We also want to check on how is your respiratory, how are you breathing. We'll also want to check on how is your blood pressure. So with that, when you walk in and you are checked, as a vital sign, it is able to prompt and know the blood pressure is a bit high, even though there are also other causes of high blood pressure. Like, for example, now you've mentioned asthma. So the difference of chest pain of asthma and this one is asthma, one, there is a history. So a patient will always mention that I have asthma. Number two, you'll hear there is a sound that this patient will always have, a wheezing sound. So it's like a whistle, and the reason why it comes with like a wheezing sound. Another thing is difficulties in breathing. So this patient always will give you a history of, I have asthma, I've been having asthma, I use inhalers, and I have chest. So this chest pain will come because of inflammation, and again, the muscles struggling to get air. So, or there could be an infection which has triggered that asthma. So you can easily differentiate through the symptoms, and again, ideally, doing what is called examination and getting to know, is this asthma, or I'm dealing with more than the asthma. Yeah.
Okay. I know this is something that you've also witnessed, or maybe you have seen.
Yeah.
Some people who die out of hypertension, the high blood pressure. So what would you talk about? Because you are saying that it's a silent killer.
Yes.
Okay.
Yeah.
So.
So again, I'll say it is a silent killer. I'll continue repeating that because many people don't know. And you'll find that people can take it lightly, even if they know they can take it lightly, until one day a stroke comes in, until one day your heart, you get what is called a heart attack. So it builds up without you knowing. Maybe people do assume that I have high blood pressure, or they get to understand that, oh, it is normal, maybe because I have stress. So death will always occur because of consistent high blood pressure, which is now damaging, I'll say, the heart, the kidneys. That is one. Number two, because of the narrowed arteries and veins that I initially mentioned, you can easily get what is called a blood clot, which easily blocks your heart. So that is where a heart attack comes in. So again, stroke can come in. So I'll mention the complication later on. But as I mentioned, I want to keep on mentioning so that at least our viewers can be able to understand why is it called silent. So once they are able, we call it silent because it can easily cause a damage, or it can kill you. So that is essentially why high blood pressure is silent and kills people. Yeah.
Okay. Now, I want us to, because you've mentioned that we'll look at it in later on, on the complications that are caused by hypertension. And is it that it is caused by hypertension or by a person who is not taking care of him or herself, or even the person who is also taking care of him or herself?
Okay, thank you. So I'll just maybe give you a small staging of hypertension so that we get to understand when is it necessary to take action. So it is called classification of hypertension. So as I mentioned initially, is ideally you need to know what is my blood pressure, because again you can walk into an hospital, you just taken on your vitals, then you're told go. So the doctor will keep it to him or herself that the blood pressure is okay. But as a patient, it's always good to know what is good blood pressure, what is high blood pressure, what is low blood pressure. So as I mentioned, we have an average BP, we always say 120 over 80. But again, we always say it varies because our age also varies. So it varies with age, moment. I can check your blood pressure now, it's 120 over 80. The next 2 minutes, maybe you're so happy, it can go high. So again, anxiety can also cause it to go high. So as I mentioned, the blood pressure average should be ideally between 90 over 60, that is the systolic and diastolic on the lower side. Then on the upper side, 140 over 90. But again, the staging comes in where there is what is called pre-hypertension. So pre-hypertension is you're not yet there, but you're headed there. And again, we mentioned about what is the correct technique of taking blood pressure. What is the interval so that we can say, yes, you have high blood pressure. So number one, correct measure. I always like at least making people understand that when you go to hospital, they can say, oh, check my blood pressure on the right, check my blood pressure on the left. So in whichever case, they both give you results. But we always say, if the results, let's say, for example, the systolic or diastolic has a difference of more than 10 mmg, that is millimeter mercury, then we'll be worried. And we keep checking on that one, which is high. But I will not say that keep checking on the left. But we also want your arm to be rested. So let's say, for example, you walk into a hospital as a patient. So you need at least to take some rest, between 5 to 10 minutes rest. There are activities also that can make that blood pressure go up, which you need to avoid. So for example, taking coffee is one of the factors that can make your blood pressure go high as you are going to be checked. Number two is excess anxiety or happiness can also make that one. And that is where what is called white coat hypertension comes in. You see a white coat, your blood pressure goes up. So, so you need also not to, if you have walked, you rest. So at least take 5 to 10 minutes rest, get into the facility. As the doctor is checking or the nurse is checking your blood pressure, you should be rested, stay calm, not talking, not being on phone. Then at least the arm should be raised at least to the level of your heart or slightly raised, and put it on rest to at least somewhere. So with that one, it will give us at least an appropriate result. So that is one. Number two, also, if you've checked on it and maybe the doctor is worried, you can rest and repeat it again. So at least 3 times, we can see how it is, and you should not be scared. A doctor also should explain how it is. So with that, ideally, we can say, yes, we've checked on you, and this is how it is. So ideally, I'll mention and say that the correct procedure also determines how your blood pressure is. Yeah.
Thank you so much, Daktari. I think we are going to take a short break, but we will be back with more on the prevention, on the diagnosis, on the management. And as Muslim, right now we are heading to Ramadan. Ramadan is around the corner. As a person who has hypertension, how am I going to deal with hypertension during Ramadan? Therefore, we'll get to understand deeply hypertension in Islamic context and in Ramadan context. Therefore, stay tuned, don't go far.
JamiaTV, beacon for the nation.
أعوذ بالله من الشيطان الرجيم. يا أيها الذين آمنوا إذا نودي للصلاة من يوم الجمعة فاسعوا إلى ذكر الله وذروا البيع ذلكم خير لكم إن كنتم تعلمون.
Enyi mlioamini, munapoitwa kuhudhuria swala ya Ijumaa, fanyeni haraka kuikimbilia, muache biashara zenu, hilo ni bora ikiwa mwelewa.
Isikilizeni kwa umakinifu khutba ya Ijumaa
ili uzidi kujenga imani yako na kupata faida nyingi ya siku hii.
Coming to you every Friday from Jamia Mosque, Nairobi.
Live on JamiaTV.
Verse of the day.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم.
المال والبنون زينة الحياة الدنيا والباقيات الصالحات خير عند ربك ثوابا وخير أملا.
JamiaTV, beacon for the nation.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back. This is our second segment of Live Real Talk Show, and we continue from where we left. Daktari, maybe you can proceed from where we left?
Yeah, sure.
Okay.
Thank you. So, I was just trying to at least ensure that people get to understand at what point are you told that your blood pressure is high. So I was talking on the stages, and I mentioned this is the average. Then I was saying at least on the pre-hypertension. So we also have what is called stage 1 hypertension. So this is a blood pressure of ideally 140 over 90 to 159 over 99. So ideally this is what is called now stage 1 hypertension. So the importance of getting to understand the stages is ideally with this stage 1, what medications do we give you? Stage 2 is now above 160 over 100 to at least 179 over 110 or 109. So that is what is called stage 2. Then we have now more than 180 over 120. So ideally this is what is called hypertensive crisis or urgency. So the importance of getting to understand, it also helps the doctors in ensuring that what kind of measures do I take now. If it is 180 over, above 180 over 110 or 120, I need to take instant action because we have what are things at stake like organ damage, including kidney failure. I can easily get a heart attack. So that is the importance of getting to know what stages of hypertension I'm in at. Yeah.
Okay. Now, I want us to look at also the burden of hypertension in the health system in Kenya.
Okay. So, sure, hypertension is amongst, I'll say, top 3. They are called non-communicable diseases. So these are diseases that you get them as an individual due to, as I mentioned, lifestyle, age. So I'll say the hypertension is like the second one after cancer. So cancer contributes to almost 40 to 50% of the non-communicable diseases. The number 2 is hypertension, which at least studies have shown that between 1 to 5 people seated together, again with age, more than 18 to at least 80 years, you will not miss one who has hypertension. So in a gathering of 5 people, you will get at least one who has hypertension. So it is a burden. And number 3 comes to diabetes. So it is a burden because we lose people due to that. And the reason why now we need to educate our people so that they get to know what do we do so that at least as much as I have hypertension, what do I do to continue living a healthy life? Yeah.
Okay. Now you can talk about the diagnosis of hypertension.
Okay. Sure. So again, as I had mentioned initially, diagnosis is majorly on how your blood pressure is, the staging that we had mentioned. So anything above 140/90 with different readings and in a span of like 3 to 4 days to 5 days a week. 2, we are able to see a consistent blood pressure going up. That is one thing that can confirm that you have a high blood pressure. Number 2 is on the symptoms that we had mentioned. Persistent headache. We also have blurring of vision. You also have what is called palpitation, your heart pumping every now and then. So with this one, ideally we can say these are signs leading to hypertension. Then we have also supporting at least tests that we can do. Like for example, we need to do a kidney test just to check could it be the cause or you already have a damage to the kidney. As remember it said, it is a silent killer. So you could have already started damaging your organs. Another thing, we also have what is called lipid profile. So we always call it cholesterol. It's always good to check so that at least if it is high also, we can know that this person is at risk and could have had this issue. Something else that we always do to confirm is what is called ECG, that is the electrocardiogram. So with this one, we are able to see how is your heart function, and also something called echocardiogram. So it is a combination of many things, but most importantly is how are your readings, and with the span that we have given, with ideally again combining with the symptoms and those tests that I've mentioned. Yeah.
Okay. In the current situation, most of the people take anything they feel like taking in terms of the food. And what I can say is most of the diseases are really caused by what we take, right? So perhaps as a doctor, what would you say in terms of the diet a person should be taking?
Great. So remember we mentioned that hypertension is a non-communicable disease. So when we say non-communicable, it means what you take will define you maybe in the next future. So lifestyle plays a big role. For example, today, Zamzam, what you've eaten will describe you. If you're a person that you consistently like taking maybe fries, it can contribute to that. If you're a person who like taking junk, fast food, these refined foods, you are at risk. If you're a person, let's say, for example, who like adding salt to your diet, you are at risk. So we always say everything in moderation. We also have people who like, I'll say alcohol, people who take alcohol, smoking, and also lack of exercise. So we always advocate for at least everything in moderation, if it is carbohydrates, because what you eat can make you become overweight or obese. So moderate everything, that is in terms of portions. We always say take portion. For example, if it is carbohydrates, take a portion of the size of your fist. If it is proteins, take a portion of the size of your palm. If it is ideally, let's say, vegetables, take them in plenty, because this one ideally will help you have a standard BMI or a normal BMI. Then exercising is key. Nowadays, our life is more sedentary. You get in the morning, you get into the car, you come out in the evening, go back home, you sleep. So with these consistent things, they start developing cholesterol, high blood pressure. You start getting complications, including even diabetes. So I'll want to mention that it is you who controls this. Diet, key, exercising, avoid things that can always trigger high blood pressure. Yeah. Okay.
And what about for a person who has hypertension, and most of the time, maybe you can give us a factual or something, someone that an experience that you have concerning the patients you treat?
Great. So, thanks. It reminds me of, I've seen many patients and others. So, as I mentioned, when we see the stage of your readings, blood pressure readings, we determine if we emphasize on lifestyle, because lifestyle is part of treating, it's part of management. Other scenarios will say, no, this one we need to start on low dose drugs. So you have different kinds of drugs. And I'm so sure our viewers also, some of them use these drugs. So we have different categories. I will not want to get into deep it, but at least mention we have things called diuretics. We have what is called angiotensin receptors. We also have what is called I'll say calcium channel blockers. So all these play different roles in terms of managing high blood pressure. So how we manage you depends on how your blood pressure is. You'll find one person having one medication. You'll find another one only managing with lifestyle. You'll find even someone managing with 5 medications. So depends, and also how compliant you are. How, I'll say, how strict are you to your medication and your lifestyle? Because the more you do that, the more we reduce on complication, and the more you get what is called optimal blood pressure control. So I'll say you have blood pressure. I've seen people, you want to start them on medication, but they'll say, one, my religion doesn't allow. Number 2, they'll say, no, 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 I have a lot of stress, give me time. So the more they buy on that time, the more they get complications. So something else that I've seen is, you'll guide someone that we need to do this test so that we see if there could be something underlying, but they tell you, no, I don't believe in that. So it is, I'll say, it is always a challenge that we always face as medical practitioners, because at one point you want to help them, at the same time you want to respect their perspective. But what we always do is ensure that we've told them on the dangers and continue telling them, creating a rapport so that also our patient trusts us. So that is always our target, to ensure that we have that great rapport with our patients.
Okay. Now, since you've mentioned there are 3 stages, and with the different stages is when you are going to know what diagnosis to give, and how can this person manage in different stages. Now, with this 3 stages, perhaps you can tell us the different management that can be taken.
Thank you. So as I mentioned, one is pre-diabetes, pre-hypertension. So with pre-hypertension, we always advocate for lifestyle. If you are not exercising, target to exercise. At least we always say 30 to 45 minutes every day for at least 4 to 5 days in a week. Even walking is part of exercising. So you don't need to go to the gym, lift weights, no. Do something which is cardio. That is one. Number 2 is ideally also on what you eat. We mentioned, watch on what you eat. Avoid a lot of coffee. For maybe generally those who drink, we tell them reduce or stop drinking, quit smoking, and majorly, again, avoid junk, because that is where the issue is. So you maintain that healthy body. When it comes to stage 1, we try see how bad is it and how are the symptoms. Do you already have maybe target organ damage like kidney failure? Do you have a heart issue? Do you already have maybe what is called dyslipidemia, high cholesterol? So do you already have blurring of vision? So with that one already, we can be able to know how we are going to intervene.
So maybe to cut you short before you continue, because you've mentioned you are on stage 1, and you're explaining on the complications that maybe stage 1 has caused. So does it mean that it doesn't matter which stage you are?
Yes, it doesn't matter. Because if you're already on stage 1, it's already high blood pressure. But now the chances of you having the damage is, the higher we go, the higher the damage of the organs. So, and the reason why we always say, immediately we see and we diagnose you of hypertension, there are routine tests that we need to do, so that at least we are able to know how far is the damage of hypertension. Remember, as initially mentioned, that it is something that it is silent. It has been eating you up. So as the moment we are diagnosing you, ideally maybe there is a damage. And the reason why you instantly need to do a screen to see, are there any damages so far to our bodies. So on that is majorly on, we have pre-hypertension, then we have stage 1. Now stage 2, that is what we mentioned about between 159,
160 to over 100 to 170.
Yes. So with that one, that is when now we combine lifestyle and some agents of drugs. So depending with, again, we have different ways of giving. We can give nowadays, because of what is called pill burden, you have a tablet which has like 3 components inside, which help to at least control your blood pressure. So with stage 2 or stage 2 majorly, we can give you an added more drugs now, but in one tablet. Stage 3 is an emergency. It's called hypertensive crisis. That one you can easily lose someone or have a permanent damage. So with that one, we have to act instantly. So if it is an admission, we do what is called IV medication, just to try control your blood pressure, not again instantly to drop, but again in a moderate way to ensure that you are out of danger. Yeah, so those are how we manage those stages of high blood pressure.
Now, there is this mentality of people that when you have chronic disease, that means there is no cure, that means it's not treated, and eventually I will die. So, as a doctor, what's your take on that?
Great. So, I'll say, yes, hypertension is a chronic disease, but it's manageable. And managing it is ideally, see, hypertension, as we mentioned, it is non-communicable. That is one. Number 2, it is a chronic disease. So it means you are either going to live with it for quite some time. And I'll say, as mentioned initially, in terms of managing it. So management is key. And management is both as a doctor and you as the patient. We need to work together. So ensuring that I explain in depth where we are and why you should take this medication, so that you don't feel that you've been forced to take the medication. And you as the patient, remember when I prescribe these drugs, you go with these drugs at home. So you can choose to take them or say it's okay, I'm not going to take them. So as we mentioned, it is chronic. So what you need to do is to be compliant to your medication, because our target is to ensure that we don't get complications, because the more complications you get, the shorter your lifespan is. As long as your blood pressure is optimal, within what you mentioned is okay, the lesser chances of you getting complications. So taking drugs is to ensure that you live a normal lifestyle, less of complication. You live like any other person. So you don't need to lose hope and say, since I have this chronic disease, now I'm going to die. No. There is hope, because do what the doctor is explaining. Be compliant to your medication. Follow up on your clinics. For that one, you live a normal life like anyone else. Yeah. Okay.
Now, something else is that as Muslims, we are heading to a holy month, Ramadan. This is whereby we fast the whole day, from morning till evening. Okay. Now, because you've mentioned that some diseases are caused by poor dieting and something like that. Now, fasting is all about not eating, not drinking. Okay, within a specified time. Now, for someone who has hypertension, what would you say? What's your opinion on that?
So again, we'll always say we respect religion. Yeah, and again, as a doctor, we'll always guide you based on your health. So I have patients from the Muslim community, and we are very close, and they always share it with me, and I always give them the correct advice that yes, fast. So if, for example, before you start it, I think it's almost between 4 a.m. to 5:30.
From 4:30. It varies. It varies with places. 4:30 in the morning till 6:30 to 7 in the evening.
Good. So I'll advocate you have to take your medications. That is one. So take them early in the morning. So the only thing that will change is on the timings. So take them early in the morning. So because you have maybe people who take once a day. So take them that early morning. Because if it is 24 hours, 24 hours will be your early morning again. That is one. Number 2, during the day, for those people who have high blood pressure, at least once in a while, be checking how is it. So for those who are taking morning and evening, just at least give a span. If it is, because people are different. There are people who take 6 p.m., people who take 8 p.m. So as long as you followed a difference of at least 12 hours, if you've been given maybe twice a day, it's still okay. So I'll advocate, yes, we can combine the two. Fasting at the same time taking your medications. So for hypertension, I don't have much issues, but at least as you are fasting, pop into a facility, be checking on your blood pressure, maybe twice a week, just to ensure that you maintain both of them. Where we always have a tussle, sorry to say, is when you are diabetic. But that is a discussion for another day. I hope I'll get another chance to discuss on diabetes.
Inshallah.
Yeah.
Now, as a doctor, as a practitioner, to the people who are watching us right now, we had a Daktari last week on matters of oral hygiene, and his advice was people should be doing checkups after every 6 months. Now, when we talk about general health, what advice would you give people?
Great. So I'll say, one, your health comes first. Your health is Zamzam, because you take care of your health. I don't know on how often you visit hospitals, but the reason why I know that you don't, it's because maybe your age is still, you're still active, you don't. So one, I'll advocate, if you are next to a facility, always be checking your blood pressure. So that is one. For the elderly, I'll say above 40 years. I don't mean to say 40 years is elderly, but again, with the lifestyle that we're having, age has dropped into 40 years. Initially, it used to be 50 years. So 40 years, high blood pressure can come in. So as you're 40, at least twice a month, check your blood pressure. If your doctor has told you that your blood pressure is a bit high, be consistent. Maybe once or twice in a week, it's always good to check your blood pressure. So, and you'll get clear guidance. So I'll always say, one, be monitoring your blood pressure. The number two, it's also good to do a screen annually, because we all work hard, but the body that is working hard, we don't appreciate it by ensuring that, you see, a body also is like a car. You need to do service. You need to be checking, is everything okay? So I always like saying that annually you need to be doing some screening. For the, I'll say above 40, I've developed at least like a calendar for them. After every year, you need to do a general blood test, need to do a sugar test, you need to be checking on your blood pressure, check your kidneys, check your liver, check also your kidneys, how are they performing. So at least that routine thing, you put it in your calendar. It's really important for your health. We always say preventing is key. Then again, I always advocate, do exercise, watch what you eat. So all these ones will help us in preventing hypertension.
And lastly, due to time, perhaps you can tell us how can people get you?
Great. So I'll say we are available on call. That is number one. We're always available. And we are next to you. We have Uma Medical Center just next to the mosque. It's in Banda Street, a Portal Place house, just opposite Kilimanjaro. I think you always call it ladies' entrance. Yes. So we are on first floor. There is a pharmacy called Ashim. So you come there, you'll always find us. And I'll say we tend to give passionate services. So you can always find us in case of your health, hypertension, diabetes. Please visit us. And also general checkup. Just come.
Wow, shukran sana Daktari. That was really amazing on educating our audience on matters of hypertension. And all I can say to sum up everything, I would say is health is wealth. Therefore, it's always good for us to take care of our health. Daktari, si nitakuona mimi?
But you have to come at least
for a general checkup.
Yes.
Anyways, thank you so much, Daktari. That was really amazing. And to you back at home, I believe and I hope that the message is home and dry. Until next time, not next time actually, let's meet tomorrow, inshallah, for the Muslim Insight Show. I was your host, Zamzam Ahmed. Assalamu alaikum wa rahmatullahi wa barakatuh.